Is your practice tired of wrestling with insurance denials, deciphering EOBs, and watching your revenue slip through the cracks? You are not alone. Welcome to The Claim Game, the podcast designed to cut through the confusion and provide you with the best practices for revenue cycle management success. We are Jeremy and Catherine Zug, and we've been with people just like you in the trenches. Each week, we'll break down complex billing processes, share real-world solutions from practices like yours, and ask questions of the game makers and changers of healthcare so you can take control of your revenue. Let's turn those claim denials into deposits and help you return to focusing on patient care. It's time to win the claim game.
Hey everybody, welcome back to The Claim Game. As a reminder, every so often we like to take a pause to get a behind the scenes look at the game board that we're playing on and talk to the game makers and the game changers themselves. These are folks that influence healthcare at the highest levels, and they're architects of the system, whether they're payers, regulators, key players in the marketplace. And by gaining a deeper understanding of the rules and nuances of the game board, you can play this game better, right? You can win the claim game. This knowledge is meant to give you a significant advantage in allowing you to navigate the terrain with greater clarity, make more informed decisions. So get ready to learn directly from the game makers and enhance your understanding of the claim game. Today's game changer is Kay Ward. She is the founder and CEO of Lanyard Health. Lanyard Health is a health tech SaaS platform designed to manage services, reshaping provider enrollment and credentialing. With a background in healthcare administration and years of firsthand experience navigating our fragmented healthcare system, Kay launched Lanyard Health to resolve the redundant tasks in credentialing for independent group practices. The platform helps centralize provider data and automate provider enrollment and credentialing workflows. Under her leadership, Lanyard Health is building toward a bold vision where every provider, from solo practitioners to large 200 plus provider groups, can move through onboarding and enrollment with clarity, accuracy, and speed. The platform combines guided forms, smart document automation, payer-specific tracking, and AI-powered follow-ups to keep credentialing on course. Kay's work has already supported dozens of healthcare systems across the country, such as HCA, Baylor College of Medicine, and she continues to lead with the mission of making credentialing interoperable and efficient. Please welcome Kay. Well, Kay, thanks for being here. You're the founder and owner and CEO and everything at Lanyard Health. Talk to us a little bit about how you got here to credentialing into Lanyard.
Yeah, so great question. I've actually been working in credentialing and provider enrollment for about 15 years now. I got my original start at a long-term care acute hospital where I started as, believe it or not, a typist, and I would just type manuals all day. And so my chief nursing officer, she came over and was like, well, we're going to put you in a credentialing position. I'm like, I'm 18 years old. I don't have a clue what credentialing is. I just thought doctors walk in the hospital and just see you or something. You know, I hadn't spent much time in the hospital when I was younger. Doctors, yes, but not in hospitals. And so from there, she said, you know, you're going to do credentialing. And then I took one NAMS course, is Credentialing 101. I took that course, and I also had a little bit of support at the long-term acute hospital. And then it kind of just grew from there. I love credentialing. I love everything that it entails. And just to see where you follow a doctor or a provider on their journey is truly amazing in the credentialing realm. So I truly appreciate the journey of any of the healthcare providers.
Yeah, that's awesome. And so you took that experience at 18. When did you start Lanyard, and how did you know you wanted to start a credentialing firm?
Yeah, so actually, um, I started Lanyard January 2025, so this year. And what really made me pivot is I started to work at a startup, and I still, before I went into Lanyard and thought anything about launching Lanyard, I thought, I'm going to go and try to work at a startup and see if this is actually what I truly want to get myself into. I have years of experience as an entrepreneur and doing consulting, but startup life was totally different. And what gave me that pivotal moment was actually, we were doing things exactly the same that I was doing it as a consultant, and I was like, well, something has got to be better than this. And what if what how do we start to build that provider data layer and that infrastructure? And that is how Lanyard was born. We're still new and very super early stage, and the journey is very great on how we are looking at data and vertical integration. Thinking like Apple and how they innovated things and how we can apply that to credentialing and the provider enrollment realm was truly important. And that was definitely that pivotal moment to say, hey, why do providers have to start this cycle over and over and over again? Why can't data follow them the same way that we follow the patient through their journey? So that was truly that moment that was like, now I think we're on to something here. And not to say like credentialing, like the primary source verification piece, they have certain elements that move with you. But as far as the provider enrollment realm, you literally have to start over from the beginning. And you truly don't know a lot about a provider and where they've been.
Oh, for sure. I mean, it feels very disjointed to a lot of providers. And so I mean, we talk to practice owners all the time, right? They hear credentialing and they feel that knot in their stomach about this big, hairy game that they're about to enter. What's the biggest misconception or fear that you hear from providers about getting credentialed?
Yeah, so their first question is going to be, how long is it going to take? I'm not getting paid. When am I going to be
No.
able to start billing? So those questions also will as well, Jeremy, because you get people that come to you that aren't credentialed and, just want to know where to start. And so I think the most crucial thing that is kind of cliche, but have all your information streamlined. Have it all in a folder, or utilizing a free system such as Lanyard would be great, because you truly have all your information in one area. And so some of the things to get right is just making sure that your information is aligned. So you have your government
Mm.
documents. If you are looking at any Medicaid specific payers, it's truly, truly important that your data is streamlined across your W-9, your CP 575 or 147C. That's the document that certifies your tax ID number. Those are going to be some of the pieces of critical information. It's going to ultimately tie back to how you get paid. It ultimately ties back to EFT and EDI enrollment. So, all those things are super important when you start to think about where do I start, what scares you, when am I going to get paid. A lot of those questions are at the top of the hierarchy of understanding the credentialing process for our private practice owners, and making it a little bit easier in guiding them to, if they do not have the information, where do they go and how they can collect that information. I think is definitely the most crucial step to getting things streamlined and being able to grow effectively and get credentialed in as limited time as possible.
Yeah, I think that's really useful. What is your general answer to providers when they say, "How long is it going to take to get me credentialed?"
Yeah, that's the biggest point of contention right there. Like, how long is this going to take? So we have some payer insights that's valuable. But what I always like to tell providers is you want to start as early as possible. And when you're looking at the timeline of things and how long things are going to take, right? It's going to take you at least 60 to 120 days gracefully. You want to prepare a little bit longer for a certain plan. So your Medicare Advantage plans, your Medicaid plans, those are going to be along those lines. But I always paint the picture that This is going to take at a minimum of 60 to 120 days. Each provider is different, each practice is different. Every payer has their own intricate guidelines that they like to follow. So you just want to pace yourself. And I understand the need and the necessity to want to get paid as quickly as possible. But you will also want to save yourself minimal delays when you're going into the credentialing process, making sure you have everything together and reaching out to experts that may have that knowledge. You can't be perfect at everything, so it's okay to lean on others that have that knowledge, that has done it and been around the block before. And so that's truly important about being able to know how long is it going to take me to get credentialed, because we can provide guesstimates, but you never actually really know, because there could be some red flags that are thrown, especially if you have any red flags. Name changes are things that are also something that is super important. Making sure your license matches all your information, making sure your CAQH is updated. So all that affects the timelines of when you actually will be able to start seeing patients.
This is one of the most important lessons that we try to set the expectation with providers with as well, is if your information is not uniform across every document, and if you don't have it organized, you actually become the limiting factor in your credentialing, right? If you have all of that organized and it all matches down to the same number, this can go a lot smoother. So for a private practice owner who's just starting out, or one who's even looking to add a new payer, what's the first, or what's a crucial step they have to get right, other than obviously getting all their information streamlined, to get right in the credentialing journey to avoid major headaches down the road?
Yeah, to avoid major headaches down the road, you want to ensure,
Mm-hmm.
which is something that is critically forgotten about, is your CAQH. You want to ensure that's updated all the way through the beginning to the end. You want to make sure your employer information is updated. If there are any gaps, make sure that's reflected in your CAQH. Um, any of your practice location information. You want to make sure all of that is there. And one area that is typically usually forgotten about is patient limitations. You want to make sure that information is inside of your CAQH, because internally, I think there will be a big shift later now that there are talks around CMS establishing a national provider directory. I believe, in my own opinion, that a lot of that could be driven from CAQH as well, and what's reflected there. So you want to use that also as your data repository. Also, you want to ensure, if you are enrolling in Medicare, that your PAYCOS is, you are the owner of your PAYCOS as a private practice owner. If you're
Yes.
interested in Medicare, please ensure that your INA reflects you as the private practice owner, because that is the biggest area of contention that we are working on now. Getting you switched over is one of those areas that is one of the hardest thing, has been the hardest thing to do, because of course we're dealing with governmental payers. So we just want to be mindful of those things. Those are some major areas that are all often forgotten about. Also in your CAQH, ensuring that you have global authorization. Global authorization is you authorize everyone to pull your information so that payers can go in and grab information when they need to. So I think those are some of the areas when you start on your private practice journey that are super important, also forgotten about. And it's not a rush game. You want to make sure that when you're starting the credentialing and provider enrollment process, that you're thinking about your timelines. Those are super important. So yeah, that's a really great question, Jeremy, about private practice owners and what they should have in place. And I have free checklists if anyone would be interested. Super free. Make sure that you can, Jeremy, we can offer this in the show notes and things. But
Yeah, for
also,
sure.
there's a checklist that I have that really helps private practice owners, and it hits all those dots of your particular states, what these states ask for versus these other states. So it's super important to have that information readily available. And I'm always a
Yeah.
resource to be able to help.
Yeah, definitely send that to me. We'll include it in the show notes for sure. That's all very helpful. And working with government payers, whether it's credentialing or billing, is always just a touch more complicated than commercial payers. And that makes sense. I think that's to be expected for sure.
Very true.
Oftentimes, and I think you hear this a lot too, but we hear a lot of providers talking about the waiting game with payers. From your perspective in dealing with credentialing as a service and making sure that the information across healthcare verticals is consistent, what are the most common bottlenecks or unexpected delays that providers encounter during credentialing? So we'll just start there. But if you also want to add, what are your tips for navigating those unexpected delays or bottlenecks?
Yeah, that is a very amazing question, actually. So, some of those bottlenecks come from providers that have been in multiple locations, making sure that all those locations are, if you're not active with any more of those locations, making sure that provider groups terminate you from those locations, and also just making sure that your
Yes.
contracts are definitely reflective of where you're practicing, because you don't want to be a subject of any unexpected billing, So that's one area that I think is super important. And another area that could be bottlenecks is definitely making sure your life. I'm trying to think from high level in the provider enrollment aspect of things, but definitely that's one. Other areas I've seen is the W-9 specifically. So if you are filling
Hmm.
out your W-9 and you have a practice and it's an LLC S corp, please include that in line one. Do not include your name in line one. This is
Hmm.
one of the biggest bottlenecks. Please ensure that your practice name is in line one. And you do not need to list your
Hmm.
name unless that is your DBA name. Unless your name is your DBA name or something of the sort, please just solely list your practice name in line one. You want to make sure that that
What
is
happens
signed
if,
and dated.
sorry to interrupt you there. Yeah, no, I'd love to know what happens if line one is incorrect. What becomes the bottleneck there?
Yeah, the payers immediately push it back. They push it back. This is
Oh.
specifically for, it's going to be specifically more along the lines of Medicaid, but I've been seeing some
Hmm.
commercial payers kind of push back on this as well recently here. And so, if those things are not, your application can be returned and you will be facing further delays than normal. So, you want to think another 30 days before they even try to respond to you. So, now you're in a 150
Oh.
day waiting cycle, which is a super nightmare for private practice owners that are just getting started or even trying to scale and grow. You want to make sure that those things are accurate, and those are definitely tips and tricks, because lots of people don't know those things. And I would say out of last week when we onboarded some new providers, at least 50% of them had this error. So I'm noticing that it may be an area of contention there
Whoa.
as well.
Well, this is why you're here, right? Because you're going to educate providers on what they need to do to avoid that kind of thing. And that's what Kay is talking about, right? When we're thinking about having your information streamlined across all your documents, I mean, think about that. You have one line of a W-9, and yes, that rhymes. That's incorrect, and that's you've just bought yourself another 30 days, I mean, that's not small. So, no, I really appreciate you sharing that for sure. And then, so we have the credentialing process, which is 120 days. But once you're done playing the credentialing game, you're not really done, right? What's the hidden burden of maintaining credentialing status with payers?
Yeah, maintain one of the areas that a lot of providers, you know, kind of quickly forget about is recredentialing attestations. And when I say attestations, I mean from CAQH and also the payer, to abide by the No Surprises Act and their regulations. Providers are required to attest that their information is accurate and true every 90 days. So that's CAQH's requirements. You also have availability requirements. They have around the same 90-day requirements and time frames. So you want to think about availability, and availability is a portal that facilitates a multitude of functions. However, the directory updates specifically. A lot of the payers go through ability to be able to capture a lot of that information because it funnels so many things in so many aspects. So definitely, that's we've talked about recredentialing, attestations, also different portals and different payers will reach out to you for ad hoc information, and that's done via email, and it usually is snail mail and things that are forgotten about. But what you want to be wary of is that payers can limit you and they can stop your payments if these things are not done. So I'm actually going through that with one of my customers today where there wasn't any reattestation and now the payments from a specific payer are being limited. So you want to be careful with that because if you're not doing what's required of you and what you are contracted to abide by, because you're signing these contracts and those things are there as well, that you need to attest to your information in X amount of days and X amount of time. So you want to be mindful that those are areas that are often forgotten about. And going back a little bit to the recredentialing, you're required to do that every 3 years, and that's usually automated by the payer, which could come by mail, U.S. mail. I've seen a lot of payers still send things via U.S. mail, and some of it is auto-generated via CAQH, or payers can reach out via email. But if you're a provider that's working in multiple locations, there's just a lot of gray area there on where should we send this recredentialing paperwork, who's responsible for it. And from a provider perspective, that's usually someone in their office, right? But they could be working at multiple offices, so then it gets a little bit more confused down the line. So you just want to be mindful that you're staying on top of it, or if you have someone that is facilitating this work for you, you just want to ensure that they're on top of it as well.
For sure. And is this where Lanyard Health helps with that underlying burden as well? Or is Lanyard, once you have a contract in hand and a start date, you guys are done?
Yeah, so Lanyard truly comes in and helps the private practice, independent group practice model. We focus on the underserved, which is our private practice owners. We truly become the one source stop place of truth for our independent and group practices. And what do I mean by that? We
Mhm.
keep all of our information in one area. So you're no longer searching through spreadsheets or through Google Drives or through a photo album on your phone, just trying to get all the information as you switch from employers. So we come in and we are that layer. We're there to support our private practice owners. A layer that we do have is we prevent fraud by providers actually verifying their identity in the platform. So that is a layer that we have, and that also helps with any type of billing that is not supposed to be done. So we come in and we do that as well, and you have a place to store your contracts all in one area, and it's absolutely free for our individual providers. If you wanted to go in and manage that process as well, you can go ahead and do that. You're no longer depending on Google Drive. You actually have a platform that supports you and know exactly what you want and you need. So it pulls out your license dates, your when do I need to reattest AQH next? When do I need to do all of these things? And it truly becomes that area that supports independent and group practice providers. And it's truly been significant in shaping the lives of our practice owners.
I can imagine. And I can imagine a provider that starts a practice would want to be involved in that process. They'd want to know. And then I can totally see when a group practice would want to hand that off to an admin or to you or to somebody else in their office. And that dovetails into another question I have for you, which is a lot of providers, you and I have both seen this a lot, try to DIY this process to save money. What are the markers that a provider should be looking for that indicate that the DIY approach is actually costing them more in time, stress, and revenue?
Yeah, it truly becomes challenging when you're trying to navigate patient care and then also kind of manually try to track where these things are, right? It becomes really hard because you're in an 8 to 5 for 8 to 4 type of ordeal all day with patients, and that leaves no time for you to follow up on your applications, which is the most critical area because you want to make sure that your application is going through all the channels that it needs to. So when in that area where it says, okay, this is too much, like I can't do this, anyone can submit a credentialing application, right? But it's the channel and it's the chase that you have to go through to actually make sure it gets approved because payers don't care that you submit an application. It's up to you to make sure you follow through on that application and you actually get that contract. So the DIY approach is fine. Almost anyone can do credentialing if you can critically think, but also those areas that it's involved. Payers have their credentialing process. They do the primary source verification unless they're delegated to another entity. And then you go through the enrollment process, and that is facilitating the application. And then once the payer has it, you need to make sure they have it. You need to make sure it's processing. And it's just not enough hours in a day for providers to do that process. Be educated enough about it because you're so focused. Your training is on patient care. It's usually not taught in training the administrative burden that these things. I've heard many residents and many fellows say, I didn't know this existed, So then they try
No,
to DIY it, and it's like, okay, this is all a nightmare. Why do I have to resubmit
join
so
the
many of the
club.
same forms? It's like, yes, there's professionals and experts that truly can help you facilitate these processes, and we are the forgotten about in the back office somewhere in the closet, but we are here to truly shape and support. And it doesn't have to be chat approach. All you just need is just someone in your corner to support you or completely outsource this mundane process because it truly is a little bit mundane because every payer has different requirements. And as a healthcare provider, you shouldn't be the one just figuring out all those payer insights and what's important, what's not, and trying to figure all that out and also tend to patient care. So that's where we come in, and other experts in the industry are very supportive to try to help providers out and support them through their journey and their careers.
Yeah, Joe Sanok has a really good saying about this, and he talks about anything that a provider is DIYing means that they are now the highest paid DIYer in whatever that thing is, right? So
Love
when
that.
a provider or when a doctor wants to DIY their credentialing, you've now become the best paid credentialer in your practice, right?
Yeah.
Or in the country, really. The exchange of time and stress and headache in exchange for the financial cost for outsourcing is well worth it because it's not your time. And it makes sense to have somebody chase this stuff down.
Yeah. And it's all
So
about time.
now we,
Your time is valuable and important. Like, you want to focus on what matters, and that's either scaling and growing if that's what you decide to do, or focusing solely on patients. That's what your training is, and that's what you're there to do.
oh, 100%, 100%.
This episode was brought to you by Insurance Billing Basics, steps for therapists to successfully take insurance. As mental health clinicians, you're experts at patient care. But let's be honest, insurance billing isn't usually covered in grad school. We've felt that educational gap for a long time, and that's why we poured years of billing expertise into one game-changing resource, our book, Insurance Billing Basics by Jeremy Zug. Think of it as the crash course in revenue cycle management you never got to take, like putting on corrective lenses to truly see how insurance works and how your practice's billing can improve. Whether you're already taking insurance and want to feel more confident in the basics, or you're ready to finally take the plunge and start, this book is for you. It's truly the best $20 investment you can make for your practice. Ready to gain clarity and take control? Get 15% off Insurance Billing Basics today by clicking the link in the show notes.
So now we got to deal with like the 500-pound elephant in the room. I guess elephants are probably more than 500 pounds. But how or is Lanyard Health using AI to help in the credentialing process to be more efficient, effective, and accurate, or are you not using AI? And if not, why?
Yeah. So yeah, Lanyard is totally AI enabled. And so what
Mhm.
that layer actually does and what it means for providers now is that you get a profile. That profile lives with you through your career and your history. So you set it up, you verify your identity. So that assists with the onboarding process. You do that right there in our platform. And from there, we don't have this infrastructure built yet, but it is what's next on our roadmap. And so what we intend to do is connect with that, we intend to connect to different primary sources that follow you through your cycle and as long as you are a provider. And so, what makes us AI enabled is that we pull from different primary sources, and that data lives directly in our platform. And we also have an integration with CAQH. So, we prevent a lot of that duplication, and that's where that AI enableability comes from. So we directly integrate with them. So we get a lot of your data up front, and we facilitate that and correct that. And so now your data lives and you can take it wherever you like to go. It's a
Amazing.
your lanyard essentially that you're taking, and
Yeah.
lanyard, that's where that comes from, is actually your when you have a lanyard and you go to conferences, people know exactly who you are and if you're supposed to be there or not. So that's where Lanyard Health comes from, and that's how we decided
That's
to come
great.
up with that. These are your
I
credentials,
love
and you
that.
carry them with you anywhere you go. So if you can't get in, you're not supposed to be in. And we really
Which
add that added layer.
which is amazing because this is really important for an
Hmm.
established clinician at a practice, or maybe somebody who doesn't know about credentialing who's entering the world of private practice. But pre-Lanyard, what you had was each practice would collect your information and they would credential under their group contract for their practice. And then let's say you wanted to bounce, right? You wanted to start your own thing or you wanted to switch practices. You had to collect all of that again. And that is hours and hours of work. And so Lanyard, the fact that that tracks with you in the process saves you like tens of hours a week whenever you want to move around. So it
Hmm.
really enables you to be mobile in the world of practice, and that's extremely important as you move around. So the world of insurance also moves around a lot. So how does Lanyard Health stay ahead or on top of the curve with new payer requirements and policy shifts and evolving industry standards?
Yeah, we're subscribed to every payer newsletter, CMS, any listservs that are out there. We're very connected, and we're in the Weedy community. And what Weedy is an actually they prepare you for the infrastructure. So they do a lot around patient registration, a lot around payer guidelines. So we're in that community as well. NAMS is another great community strictly for medical staff professionals and also provider enrollment professionals. So they keep you up to date with what's going on with the payers or also what's going on in the credentialing atmosphere as well. And they really keep you up to date with the regulations as well. Also, believe it or not, like X, Twitter is those things that regulations and thoughts are posted there and what's going on. It's very real time, I would say. And I think those are a lot of the things. And I post a lot of what I think is real time information on my
Mm.
LinkedIn. That's primarily the community that I'm channeling. And I post a lot of information there on what's to come about for credentialing, provider enrollment, any of the payer guidelines. So definitely staying woke as it comes to payer requirements and any shifts in policy. So NCQA, the Joint Commission, URAC, to name a few. You want to make sure you're on all those newsletters, any newsletter that they distribute. So the DEA, the Department of Justice is actually one that's truly important because you can see all the different what's going on that's not typically accurate or right in the healthcare community and who's getting
Well, that's
caught
right.
some things.
Yeah, and you can see like pending investigations, right?
Yeah.
To name one, for example, right? It's not that somebody, not that a company has been confirmed to do something, but you can see like what's an ongoing investigation in the healthcare world, whether that be alleged fraud or improper billing or that kind of thing. So it is
Hmm.
extremely like that's a great outlet. And I think very few providers know about NCQA. Can you explain what NCQA is and why being on an NCQA newsletter would be helpful?
Yeah, NCQA is the accreditation body for payers, some hospitals, CVOs, which are central verification offices. So they set the regulations for lots of the insurance companies as well. And they have their own guidelines, and they put a lot of that information out that's specific to so much as provider enrollment. A lot of that is geared towards that, as well as some credentialing functions as well. And just to touch on the difference between credentialing and provider enrollment, credentialing is verifying kind of like a high level and very deep background check for any healthcare professional. And provider enrollment is the process of actually facilitating the insurance application process. So contracting all the way through, you get a effective date with your contract or a decision by the payer. So that's truly NCQA. NCQA truly guides those paths when it comes to insurance related regulations, and a couple of other things that are embedded. But for private practice owners, that's truly important to know that they guide a lot of the regulations and laws around insurance.
No, that's extremely helpful. I have a couple other questions for you here, Kay.
Hmm.
Right now, and I'm sure you're aware of this, but in Indiana, Carillon took over the management of the Anthem Blue Cross Blue Shield contracts and sent out a letter to providers that said that their rates were getting cut by around 50%. I had a call recently with a lovely group practice owner who was really scared about that and asked about, should I get a network with every payer? Should I get a network with Medicaid? What's the plan there, or what do we recommend? And I'm curious to ask you that same question, that when payers make that abrupt of a change in their rate, from a credentialing or a payer selection strategy perspective, what do you recommend?
Yeah, I recommend definitely having conversations with the payer, specifically your provider enrollment representative. You need to find out who those people are. Do not be afraid to reach out. You have signed a contract. So although we there's challenges with payers, but please build a great relationship with your payer, the contracting department, provider enrollment, provider relations representatives. Those are going to be your definitely go-to with the most accurate information that's coming down from the payer. I think that it's only right that you're nervous because of everything that is happening in healthcare. I'm nervous. I think we all in healthcare are nervous to see what's next and what's to come down the pipeline, but definitely staying involved with your credentialing and your provider enrollment process and your maintenance. A lot of it is important, and you want to make sure that if you're not getting the answers you need, scheduling meetings with your provider relations representative, though, that's important as well. Finding out who those people are, and it may take some time, and that's where experts and consultants and credentialing professionals and provider enrollment specialists can actually help you navigate those challenges as well. They're skilled enough to be able to do so. So having those conversations early is, I think, the best advice that you can give anyone, because a lot of my private practice owners don't know that those people exist. And though that's where you truly want to start. If you're nervous about things, making sure that you're signed up to their portals. They push a lot of information there. So if you're nervous, it's okay to be nervous, but just demand make sure you're getting answers to your questions, because you are contracted, and you definitely want to make sure that the payer is trying to answer as much of the questions that you have. And don't be scared to go up the food chain if you need to. It's definitely
Oh, that's
something that
good.
helps.
Yeah, that's really good advice. Would you ever recommend a provider leave a network due to a change like that? Or would you say stick it out?
I think it all depends on what your strategy is. If you are serving a market that's underserved, I think it's important to see if that's still going to be sustainable, especially with the cuts to Medicaid. You have
Mm,
to truly understand
mm,
and that's where your biller comes into play, because they really have they really have the insights on what's valuable for you. So get a biller, build a great relationship with your biller, ensure that you are having biannually touch points on your contracts, making sure that you understand, is this payer still feasible for me? Understanding that it's okay to say walk away from your contract. You have every right to do so. Abide by your contract, give them a sufficient notice if it's no longer working. Usually it's around 45 to 90 days when you need to let the payer know that you wish to terminate from their networks. So all
Whoa.
of that is written in your contracts. Know what's in your contract. Don't be afraid to ask for updates or changes to your contract after you've been in network for ample amount of time. I know providers who's never looked at their contracts in 15 years. So never have asked for an increase. It's,
Oh no.
yeah,
That's no good.
you really want to know. You have to have a strategy, and a great relationship with your biller start is super important. They have all the numbers, all the information that you need to say, hey, this is no longer working for us, or seeing this subset of patient members, it is no longer working. It's becoming super expensive. We're not getting the rates that we thought we were going to see. There's no increases. They're not offering us any value here. And although, taking care of patients is important, but as a private practice owner and group practice owner, you truly have to make sure that, you're not doing pro bono work, you typically. And so you want to make sure that you're still able to feed yourself and feed your family based off your contracts and things that you have in place that is going to ensure that you are able to sustain yourself.
For sure. What are some of the things that you enjoy negotiating in a provider contract, or you would recommend a group practice or private practice negotiate in their contract?
Yeah, so definitely you want to negotiate higher rates and where you can, right? And so to do that, you need data. Essentially, if you are a new provider that's joining the network, you don't have a lot of data to back what the requested rate increases that you would want to see. So generally, I tell people, maybe go ahead and take the contract, but definitely build up your value proposition. Why are you valuable to the payers network? Why should they give you an increase on your rates? And also some of the things that for larger groups, specifically larger private practices, I say negotiate credentialing time frames. So some of those things can definitely be negotiated, but payers just want to know how valuable you are and how are you saving them money? How are you being able to offer services to your patients at a lower cost, and how much is it truly costing them to keep you in their networks? So all of those things are super
Hmm.
important when it comes to actually understanding what is your value. And I can't say that enough, because do you have certifications? Are you in an area that is not saturated? What sets you aside from all the other practices that's out there? And that comes with strategy. I can say, yeah, I want to start a private practice, but are you going into that area and it's saturated? All of that is important when it comes to knowing your market and how what you can contribute to the payers network. So when you talk about what is good to negotiate, I think those are definitely solid areas. Any carve outs that you want to negotiate, but having a sound relationship with your biller, they really have that expertise to be able to kind of also guide you into those areas that you can improve or request those certain increases by the payer.
Yeah, one company we really like to recommend because of the data insights that they provide is Serif Health, and we'll include a link to them in the show notes as well. But if you really want to get some high level and low level data insights into what payers are not only paying you, but also the big MSOs or other practices across town or other counties. Seraph Health really breaks that data down. They're not a sponsor of the podcast by any means. We just really like the fact that they provide the data insights that practices need, like what Kay is talking about. And it's extremely important that you have that data, like she's saying. And I think what you are saying, Kay, is extremely important, because if you can't demonstrate data with data that you are valuable, why would somebody give you a raise, right? And that's essentially
Exactly.
what you're asking for, is you're asking for a raise, for
Exactly.
sure.
And
So for a practice
yeah.
owner, yeah, yeah. Yeah, for a practice owner listening right now who feels overwhelmed by their credentialing situation, maybe it's really messy, scattered, disjointed, denied, who knows, right? All the scary things. What's a simple, actionable step that those providers can take today to regain a sense of control?
Yeah, if you're lost and have no way to go, I'd suggest reaching out to any credentialing support consultant, enrollment specialist to get a grab on what your current situation is. Don't wait until it gets
Mm,
bad for you to start reaching out for some sort of support. I see that more often. And then now you're in a debacle and you're not getting paid. You want to make sure you have solid workflows and processes already in place, because you can't scale if you don't have any, if you're not a scalable practice. Make yourself a scalable practice if that's what you intend to do. Have a sound biller. Talk to Practice Solutions. Talk to Jeremy. You want to
mm,
make sure you have a great you want to have make sure you have a great relationship with your biller and know exactly what's going on. It's so important that credentialing teams and billing teams have great and sound relationships. That way, if there's any
hmm
areas that they can support one another, credentialing supports billing, billing supports credentialing. If there's any way that's truly important, and I think that's the best course of action. That's a very actionable step, making sure that those relationships are sound. Also, if you're experiencing any or overwhelmed by the credential, I think most practice owners get overwhelmed if they're credentialing and they stop getting paid immediately for something. So if you're in that position, you definitely want to get help as soon as possible. Um, be
hmm
be Make sure that you know exactly what your situation is if you are in an area where you're not getting paid. I see this often. I think that's one of the number one things where a practice owner seek help. I'm not getting paid. Did I do something incorrectly? How do I change my individual contracts to group contracts? Because you initially signed up as
hmm
an individual provider, and now you don't know how to change over to
Oh,
those group contracts, which is the biggest area. Now you have five providers, and and then you just have to know what's more beneficial for your practice. Should you stay? Should you have all of your providers individually credentialed, or should you go ahead and create that group contract where it's important to do, and get that? You just want to really have those workflows and your onboarding process a sound, informative. You want to make sure that your clinicians that are onboarding have a great experience. The provider experience is just as important as the patient experience. So going back to, if you're feeling overwhelmed, talk to someone. Talk to someone who's skilled in the area that you need the most help. That's what's truly going to take you out of that stressful situation.
yeah, I can't agree more with all of that for sure. Is there a like a case study of a practice that got through credentialing really well? Like, do you have like a golden client story that you can share?
Yeah, I think the best client story that I can share is providers that are responsive. If you are interacting with a credentialing company, make sure you're responsive. If you want to get things done quickly, pick up the phone, attend the meetings. All of those things are super important.
Mm.
If you want to get through credentialing as quickly as possible, I think that's been my golden standard. Just having effective communication for our new and private practice owners, ensuring that that you can lean on those people for support, that you're not asking too many questions because that's what you've hired them to do. My ideal best customer story asks me a bunch of questions so that they prevent any of those delays later on. So I don't care that people ask a bunch of questions. I prefer you to do that so that we are all aligned and on the same path. So it's super important. I think a lot of areas, I think the biggest area where things start to break down and go crazy and siloed is communication. And it's cliche and simple enough, but communication is everything when you are going through these processes. Multiple touch points. Get you a bi-weekly meeting schedule. These are all things I have in place with my ideal clients that are successful in the credentialing process because they're truly listening. Be an active and listening ear. You want to make sure that, because maybe your area is not a credentialing specialist or provider enrollment specialist, and truly lean on the support that you've hired. That's the ultimate customer experience for me. Lean on me when you need me. Make sure that you're responding when you need to. That's how we have a truly great working relationship, is that eyes are open, ears are listening.
Oh, that's good. Yeah. My last question for you today, Kane. This has all been extremely helpful, so thank you so much.
Oh, of course. I'm happy to
Last
be here.
question. So the claim, yeah, great. The claim game exists to help providers navigate revenue cycle management with best practices and good processes, and it helps them win at the claim game, right? So, with all of that said, if we were to erase our entire interview and you wanted providers to walk away with one piece of advice around waiting for applications to process or credentialing, what would your one piece of advice be?
I think my one piece of advice, if we erase this entire interview and I could give one thing to providers to have in place, or just my best piece of advice, and I think I might have said it a couple of times here, but it's really making sure your legal documentation is in order. That is truly going to be one of the biggest areas that is seen as delays in provider enrollment. And initially, you're not getting paid without the provider enrollment cycle. So you want to make sure all of those things are into play. CAQH is updated, PAYCOS is updated. Know your passwords, write them down, because it's harder to get them if you don't know what email they were attached to because you stopped working there 10 years ago.
So true.
Those are really
It's
things that
so
you want to
true.
keep. Keep those passwords to your portals, keep all of that. If there are surrogacy processes, make sure that there is, that you have, that you know exactly how to invite people to see your information. I think those are going to be my top three, because it's truly hard if you can't start the process because the provider doesn't know their password. And so now they have to reach out to NPI or PAYCOS and try to establish. Those things take weeks. Could take weeks. Some of it is
Oh,
days.
yeah, I could.
It really can save you
Yeah,
some
or if
time.
you're the practice you're leaving. Oh, so true. Or if like the practice you're leaving has it and you left on bad terms. It's
Yeah,
like, oh
exactly.
no, it's gonna be a while for sure. Well, Kate, thank you for everything you're doing in the marketplace. I just want to end the interview by saying that I think Lanyard is doing really good work, and it's really hard work. So I really appreciate everything that you're doing for private practices, the education you're doing on LinkedIn. All the information you've provided here is just so invaluable. Thank you so much for being here with us.
Amazing, Jeremy. I've had a great time speaking and talking about my favorite lane. So I hope people are able to learn something here today. And Jeremy, thank you so much for having me on the Claim Game. I'm super excited for people to get this knowledge. And yeah, thank you so much for actually having this platform to educate private practice owners and others that will truly need some support along the way. And it's not all specific on the internet, right? You get some high level overview stuff, but truly having a resource like the Claim Game to go to and get that true knowledge to be able to scale and grow, are just if you want to know any information. So I truly thank you, and I'm super excited for the growth.
Awesome. Awesome. Well, thanks everybody. We'll see you next time on the Claim Game.
Awesome. Thanks everyone.
If you enjoyed today's episode of The Claim Game, please take a moment to leave us a rating and review wherever you listen to your podcasts. It really helps new listeners to find us. Make sure you never miss an episode by subscribing to The Claim Game on your favorite podcast app. Your feedback means so much to us. We want to provide valuable education about revenue cycle management. So if there's something we didn't cover in our topic that was a burning question for you, please let us know so we can try to get you the information you desire. You can find the links to all resources we mentioned in this episode in the show notes. And if you want to dive deeper into our resources, we have two places you can do that. First, you can go to our blog at practicesol.com practicesol.com/blog, where we have 8 years of educational blogs. If you want to learn more about what Practice Solutions does, reach out. We'd love to hear from you. Just go to practicesol.com to learn more and to connect with one of our awesome people on our team. Thanks for listening. We are Jeremy and Catherine Zug, and this is The Claim Game. See you at the game table next time.